Hello there, ladies and gentlemen. My name is Darren Brown. I'm an optometrist on the Sunshine Coast of Queensland in Australia, and I've spent a lot of time looking at and studying and trying to find a solution to dyslexia and learning problems in kids. And so I'm so excited that you've been able to join us for this special webinar. I want to outline how I'm treating dyslexias and kids with learning problems very successfully in my practice, and how you can become a part of it. And hopefully, if you are struggling with a child who is struggling at school, and if you are sort of going through the motions with them, I want to try and offer a solution for you here in this webinar that you can grab hold of, something very positive that you can do. So in this webinar, I want to help you to discover how you can conquer dyslexia and learning problems in your child and release the full learning potential that your child has, and also to escape from the homework nightmare. Now, if you're a parent of a child who's struggling at school, you know exactly what I'm talking about. A homework nightmare goes on every afternoon in your home, all in 3 steps. I'm going to outline 3 steps you can take tonight to help your child if you're struggling with this. So this webinar is for you if you have a child who's been diagnosed with dyslexia, learning disabilities, Asperger's, ASD, or even ADHD, or any of the other Ds. It is for you if you have a child who struggles to concentrate on their schoolwork or is easily distracted. Don't fall into the trap that, oh, boys are easily distracted. It's not that. Boys should be able to concentrate if the circumstances are right for them. So we're going to have a look at that tonight. Also, it's for you if you have nightly homework battles with your child, which often end in screaming or tears or some other sort of drama. It's for you if you believe that your child is capable of producing better work in school. If you look at your child and you believe they're working to potential, then this webinar may not have a lot of meaning for you. But if you think your child can do better, if you think there's more in your child that they can perform better than they currently are, this is for you. Also, it's for you if you've been suddenly surprised by a teacher reporting that your child is underperforming and needs remedial help. And sometimes you don't find this out until some years down the track, when finally a teacher says, hey, listen, your child's struggling. And you say, well, gosh, it would have been good if you told me that, 3 years ago. It's also for you if you've spent good money on treatments to try and help your child, or tutoring with little or no improvement in the child's performance or results. Sometimes you spend money on tutoring and you do get a small increase in performance. They seem to be trying hard, and I often have parents say they work better in a one-on-one situation. Well, that doesn't mean there isn't other problems. It just means that if you work one-on-one and force them to do stuff, they lift their game. So if you're suffering from any of those, if you have any of those questions in your mind about yourself and your children, then this webinar is definitely for you. I'd like to fill you in on some of my background and what led me to work with children with learning problems, because most optometrists don't. In fact, the vast majority of optometrists run 100 miles rather than treat a dyslexic child. So my name, as I said, is Darren Brown. I'm a behavioural optometrist on the Sunshine Coast of Queensland. It's a tough place to live, but somebody has to live there, and it's me. I graduated from optometry school in 1984 when I was 5. Well, okay, maybe I was a little bit older than 5. But I was soon dissatisfied with mainstream optometry practice. Handing out reading glasses to old men didn't really float my boat. And so I sort of decided to look for something more within the field of optometry. Just a few months later, I attended a behavioural optometry seminar in 1985 that changed my life. All of a sudden, a lot of the questions that I had, even with my own eyes, started to fall into place. And so I studied and completed a postgraduate fellowship of the Australian College of Behavioural Optometry a few years later. Then I started adapting some of the more traditional behavioural optometry vision therapy programs with little or no success or impact. You see, I wanted to really change the lives of these kids. I didn't just want to churn out what some other optometrists had come out with. So it started a yearning within me to learn more, to try and help these kids. But what really, I guess, changed my life in this regard is that in 1994 we discovered that my oldest daughter had a learning disability. She was Asperger's. We didn't even know what it was called at the time. We just knew she struggled enormously in school. Every afternoon was fits of tears and screams and I can't do it. And her younger two sisters are very, very bright. And so that made my oldest daughter feel very small about herself, feel very dissatisfied with herself, and think that she often used to say, you know, how come my sisters are smart and I'm dumb? And it just really hurt me. So I went on a vendetta to try and find a way. Traditional optometry had no answers. Traditional behavioural optometry, even their vision therapy, didn't hold answers for me. So what I did was I went back and I studied the vision therapy masters. Behavioural optometry actually started back in the 1920s and 30s in America, and a lot of the techniques and ideas of those early guys were lost in all the flurry of modern equipment and lots of, you know, cool lenses and all that sort of stuff. So I went back and studied what some of these guys did, and I found some absolute gems. And that's what's got me so excited and what I want to share with you. First of all, people say to me, is there a scientific basis for vision therapy? Well, there is now lots of evidence in scientific literature supporting the role of vision and visual skills in learning. And there's also lots of evidence on how the right type of vision therapy can dramatically improve learning and reading performance. Now, I didn't like the traditional vision therapy exercises. I thought many of them were dull. They were certainly hard work, and it was very hard to get kids to do them. So I decided to design my own, targeting not improving optometry measurements, but targeting how I could actually help kids in school with their learning day to day. And that's the difference in my program. I've targeted skills that kids actually use, not just tried to change my optometry measurements. So the question is not whether vision therapy works. We know it does. The question is, what type of vision therapy works best? That's the big question. So I set out on a of a vendetta, on a quest. I wanted to find help for parents of children with dyslexia or learning problems. I wanted to find help for parents who feel powerless to help their children. See, I've sat where you've sat. I've had the same concerns as you. I've sweated out and gone through all the dramas that you are probably currently going through. So I wanted to find help for parents like me. I wanted to find help for parents who are sick of watching their child struggle and stress and strain when they come to learn. Parents who are tired of seeing their child's self-esteem shattered by schoolwork, whose kids say, oh, Mum, I'm dumb, you know. They're not dumb. They can be very bright. There is a blockage. There is a lack of skills, but it doesn't mean that they're dumb. I want to find help for parents who are done with fighting over homework every night. If homework is a war zone and not a fun place, then you're in the right place tonight for this webinar. I want to find help for parents who genuinely believe that their child is smarter than their school results and who want to do something about it. You know, you can run around and say, I believe that my child's much smarter. Everybody thinks that about their kids. Listen, if they are smarter, let's find a way to make it happen. Let's prove it. So here's something to think about. I had to hit you with a few statistics just to sort of give you a glimpse on the bearing that vision can have on learning and dyslexia. This is from the visionandlearning.org and also the American Optometric Association, very prestigious association. 80% of children who are reading disabled, including dyslexics, have vision problems which can be solved. 25% of all children have a vision problem significant enough to affect their performance in school. Here's another one. 95% of first grade non-readers have significant visual problems. There's 95% have some sort of visual problems if they're not picking up reading. They have nearly 2.5 times more vision problems than high achievers. Here's a little bit more. In one California funded study, repeat offenders reduced from 45% to 16% when they received on-site optometric vision therapy. So we're not talking about something that is floating around in the never, excuse me, something that is, you know, tea leaves and all that weird sort of stuff. This is scientifically proven, both anecdotally and also in the literature, also neurologically, I might add. School vision screenings detect only 20 to 30% of significant vision problems, and I reckon that's a stretch. I think they detect a lot less than that. So if your child has been checked in school, not good enough. Seriously, not good enough. They need to have this done properly. Yet 1 in 10 children is at risk for having an undiagnosed visual problem. So, the program, sorry, this is a quote from one of my mums. She wrote, "The program has significantly improved our son's reading, writing and vocabulary." She said, "We started Darren's vision therapy program, and with each set of exercises we noticed a vast improvement in our son's ability to focus on the task. The program has significantly improved our son's reading, writing and vocabulary, and these improvements have been noticed at school." It's nice when the teachers notice it, isn't it? "Now we have a child achieving the required level in literacy and in his last report card thanks to me," which is wonderful. This really gets me excited when I get reports like that, and we get many within my practice. So in this webinar, I want to show you the little known visual skills that can have an enormous impact on your child's learning. I'd like to show you the symptoms to look for to discover if your child has vision problems. Now, you may not, a lot of people come to me, I think that they seem to see well, so I don't even know what I'm doing here, but someone told me I should get their eyes tested. Seeing well is not enough. Monkeys see well doesn't mean they can learn. It's more than just being able to see, and we'll go into some of those symptoms so you have those. We're going to give you simple tests you can do yourself at home to see the effects of vision problems on your child's learning. We're also going to show you how you can spend just 20 minutes a day doing the right vision therapy with your child and see an improvement in their performance within 3 months. Also going to show you how you can do it in your own home without expensive therapists, optometrists or tutors, and how we structure our vision therapy so we can keep you on track. We're also going to give you some free ideas for therapies that you can do with your child right now. So, excuse me, what are the visual skills that I'm talking about, and how do they affect dyslexia or learning problems? Visual skills are the skills that we have involving our eyes, obviously, but also our brain, which involve both vision and understanding of visual information, which we learn to master as we practice and develop. So typically these skills develop during school naturally as kids learn to read, write and spell, but there is a certain percentage of children, maybe they've got a visual problem, maybe they're just developmentally delayed in this area, that they don't develop the skills properly. So they should develop, and the kids should have these mastered as they're learning to read, but if they don't, we've got to do something about it. Most teachers skip the teaching of these visual skills and go straight to teaching how to read, leaving many kids behind. They skip these skills because they don't know about them, frankly. And even prep school teachers don't know about these visual skills and the impact that they have on learning. But a little bit of work early on can save you a ton of heartache later on. These visual skills are the tools with which a child actually learns. If I told you to build a table, you'd say, okay, I can build a table. I'd say, here's the wood. You'd say, fantastic, where's the hammer? Where's the nails? Where's the screwdriver? Where's the screws and the saw? Oh, no, you don't get those. You just get the wood. What sort of a table are you going to build? A pretty poor one. With many kids, when they come to learning, they simply don't have the tools. They do not have the visual skills that they need to do the job properly. We train visual skills the way that we should train visual skills the way that we train skills in other areas. Things like playing football, learning the guitar or piano. But see, if you wanted your child to learn the guitar, you wouldn't say, here's a guitar, hop on stage and play. It would be embarrassing. You'd send them to guitar practice where they'd learn where to put their fingers, how to read the chords, how to hold the plectrum, how to strum, etc. If you wanted your child to play football, you wouldn't just say, here's your jersey, hop on the field with the A-grade team. They'd kill him. It'd be embarrassing. If you wanted him to play soccer, you would send him to soccer practice. There they would learn how to pass, how to shoot, how to head, how to tackle, positional play, all that sort of stuff. Are they playing the game? No. They're just learning the skills. But when they get on the field to play the game, they can draw on the skills that they've learned at practice. Now, the problem with reading is we just throw them on the field. We just throw them on the stage. We just say, start reading. We don't train the actual tools they need to do the job. It is more powerful to train these skills separate to learning to read. And this will supercharge their reading, writing, and spelling. If you train the skills separately, you can do a great job. and then once they've got, in the same way that, you know, you don't just play football matches when you go to football training. You learn skills. They drill them on things. Then they play the matches on the Saturday or Sunday. So there is no magic bullet, magic glasses, or magic pill. You know, but don't give up. There is a way ahead. It just takes time and commitment. Believe me, the answer is not doing more of what they hate, hoping that one day magically they will improve. You know, beware of someone who says, oh, I've got this magic thing. If you put on these special colored glasses or whatever, suddenly it will solve all of your dyslexia problems. Not going to happen. You're going to be a very disappointed parent if you go for that. But the answer is not what you're currently doing, which is more and more and more reading, which they hate, hoping that one day magically the penny will drop and they'll get it right, because that's, you know, it doesn't often happen. So let me give you the 3 steps to conquering visual dyslexia and learning problems. Here they are. It's real simple. Number 1, get an eye test. Number 2, do some home vision skills testing yourself. We'll show you how to do that. Number 3, do something positive and proactive about it. Find the right therapy program for you. It is not enough to test something, find something is wrong, and leave it there. That doesn't make any sense at all. If you find something's wrong, do your best to try and correct it with the right therapy program. So let's go through these, excuse me, a little at a time. Number 1, get an eye test. I'm an optometrist. I do thousands of eye tests a year. But I would start by asking your teacher about your child's learning. And in a moment, we'll come to some of the symptoms, and you can ask them, does your child experience these symptoms? In fact, we're going to email these to you. If you give us your email, name and email, if you sign in, we will send these to you directly. So ask a teacher about your child's learning is a good place to start. Then get a professional, competent eye test. Now, you do need to know, in the world of optics, there is the good, the bad, and the ugly when it comes to eye tests. And I can pretty much guarantee you that a 5 or 10 minute test down at the local shopping centre with someone who's sitting in a big chain or a big department store is probably not going to be the most extensive eye test you can get. You want to make sure there is absolutely no stone unturned when it comes to your child's eyes. So get a competent professional eye test. Now, most optometrists will check sight and check your eye health. Excuse me. They will also check if your child is long-sighted, short-sighted, or if they have astigmatism. That's standard. All of this stuff is standard up until this point. When I see the parents of kids who come in and I say, if they had an eye test, they say, yes, they had one last week. I said, what was the result? And they say, oh, the child's got 20/20 vision. 20/20 or 6/6 vision, 20 feet equals 6 meters, just means they have average good vision. It also tells me that that optometrist has not looked any further than these few areas. So let me show you where a really competent optometrist, like a behavioral optometrist, will go from here, because that's not the full story. We will also look at focus and eye teaming at both distance and near, how the eyes work together, how the focus is exerted, what's the relationship between focus and eye teaming. Are they under stress? Are they struggling? Are they struggling even to hold it together? Is the child on the point of double vision or blur all the time? How much effort does it take? We will also look at perceptual tests, things like eye movements. How accurate are their eyes moving across a page? Visualization, can they picture things in their mind? Eye-hand coordination, directionality for left-right reversals, all that sort of stuff. How many of you have had an eye test from your child and been told nothing is wrong? I'm sure many of you listening to this webinar have had an eye test and they've said, hey, nothing is wrong, your child's eyes are fine, but deep down you sense that something is definitely wrong, and you know it's their eyes. You can feel that. If that's you, you've come to the right place. Step 2, home visual skills test. Now, I've got a bunch of these that we'll go through, but we're going to start with a symptom checklist. Now, we will email this to you, so you've got to write all this down. A simple focus test I'll show you, convergence test, an eye movements test, and a memory test. So let's have a look, excuse me, number 1, at our symptom checklist. Does your child exhibit any of the following signs? Red, sore, or itching eyes at any stage. Jerky eye movements or one eye turning in or out. Squinting, rubbing of eyes, or excessive blinking. Blurred or double vision. Headaches, dizziness, or nausea after reading. the tilting of the head, closing or blocking one eye when reading. Get aware of the guys who sort of lean all over their hands, and by leaning on one arm as they're reading, sort of with their head nearly on the desk, they're actually blocking one eye. There's another cool way. They turn their head to one side so that their nose blocks the vision from one eye. That will tell you they can't use the two eyes effectively together. The number one symptom I see is poor concentration for near work like reading. If your child can concentrate on a movie but not concentrate on their reading, you have a problem. You have a vision problem. People say, oh, they think it might be ADHD. Really? If your child can concentrate on a movie but not on their schoolwork, it cannot be ADHD, because you can't turn it off for long distance things and turn it on for close things. You're either ADHD or you're not. If the child can sit long enough to watch a movie without squirming all over the place, squirms, it's almost always a vision problem. Here's some more symptoms. Does your child show any of the following performance cues of near work? And of course the number one symptom is, I'll say it again, poor concentration. Frequent loss of place when reading. Omitting, inserting or rereading letters. Confusing similar looking words. Failure to recognize the same word. Did I? Here's some more. Does your child show the following symptoms? Are they smart at everything but school? Are they better verbally when reading or writing? Do they have low self-esteem, poor self-image, or a sensitivity to failure? I know my daughter reached a point where she wouldn't even try anything because she knew she'd fail. So she just would not try anything. Do they have frequent frustration when doing homework? That's a giveaway. If they get really frustrated and cranky, almost always a vision problem. Frequent crying, especially during homework. That's not the parents, by the way, that's the child, although it could be the parents. A short attention span, or once again, poor concentration. Irritable daydreaming. Daydreaming's another good one. Some kids daydream and the parents say, oh, I thought they were just thinking deep thoughts. No, they were drifting off, because if they look up and daydream, they're not sustaining their focus and eye teaming on the book. They're relaxing it and they're taking a break. Here's some more. Is your child frequently labelled lazy, or the child, doesn't try? Dyslexia is another one. Attention. Are they labelled a slow learner? Or are you told they have a behavioural problem? Many behavioural problems are just a vision problem. The child's so frustrated they lash out. A juvenile delinquent, same thing. Working below potential. So let's have a look at a quick focusing test that you can do with your child in the comfort of your own home. Here's how you do it. Number one, hold a book with small print 5 to 7 centimetres from their nose. Take the printed chart, which we can supply to you, and tack it to the wall 6 metres away. Check their distance vision. How far down the chart can they read? Number three, get them to change from clearing the book to clearing the chart and back again, saying yes each time it's cleared. Do this 20 times, distance and near, and record the time it takes. Now here's the critical thing. If it takes longer than 40 seconds, or if you hear them slowing down significantly, chances are you have a focusing problem and you need to get it seen to. Eye teaming tests. You can see this little boy here looking at the tip of his pen. Hold the pencil 50 centimetres from their nose, move it closer to their nose and watch the two eyes, which should turn in. People say, oh, you shouldn't go cross-eyed. Rubbish. You need to go cross-eyed to keep it single. Note the distance at which it happens. If one eye drifts away when the target is any further than 7 centimetres from the nose, you may have an eye teaming problem. How about an eye movement test? Hold the pencil 20 centimetres from the child's nose. Instruct the child to keep the head still and follow the pencil. Now you can actually move the pencil from left to right, up and down, and in a figure eight, from upper right to lower left, from upper left to lower right. Ask them to follow the pencil and watch. If their eyes are jerking or losing the target, if they cannot keep their head still, you may have an eye movement problem and you need to get it seen to. Here's a quick visual memory test. 1. Write two series of numbers 1 through 9 on separate pieces of paper cut to the same size. Hold a book to block the child's view and place two numbers randomly behind the book. So not side by side, but just at different places. Remove the book for 1 second, then replace it, and then ask the child what the numbers were. Add more and more numbers to try and discover the maximum number that they can remember correctly 2 out of 3 times. That will give you an idea of how many pieces of information they can visualize and put in their mind. We can train every single one of these things. Now, of course, this test is heavily dependent on age, but it gives you an idea. If they're struggling, you'll see if they're struggling. And if you've got any suspicions, please let us know, or get a behavioural optometrist to check your child out. Here's step 3, the most important thing. Please do something about it. It is not good enough to test if we fail to treat. If you're going to test something and it comes up as a problem, for goodness sake, treat it. Now, I know this sounds basic, but time and time again, I even have optometrists say to people, oh yeah, their convergence is a bit low, but it'll be right. No, it's not right. For goodness sake, if they're struggling, please treat it. Test diagnosing something is pointless if you think about it. And doing always better if you change, and you always over the nothing. Yes, we've measured. Here's a nice big long label that you can stick on your child. Oh, what can we do to change it? Oh, nothing. It's just the way they are. Don't accept that. It's not right. Taking the wrong advice will also see you wasting your time on money on therapies that look magic but don't work. Beware of the quick fix, the magic this, that, and the other. Magic, coloured glasses, magic, clear glasses, magic, pills, take this pill. Nothing's going to solve your problem. It's going to take hard work to catch them up and solve your problem. Not all advice works, not all therapies work. So here's a little bit more about step 3. If you're looking at therapies, and if your child is significantly behind, there is not going to be a single panacea, a big, ka-ching, here you are, your child's suddenly top of the class. Not going to happen. Even with glasses, even the right glasses, not going to happen because they're lacking all of these skills. So you're going to need therapy of some sort. So what is the ideal therapy? The ideal therapy is easy to join, easy to do, and has simple instructions. It's done in your own home, so there's no travel. How much time do you spend in the car taking kids to and from doctor's appointments? It takes around 20 minutes per school day. Longer than that, and kids get upset and are disinterested. Shorter than that, and not a huge effect is had. It lasts no longer than 9 months for guaranteed results. I've met people who've done things like speech therapy for 7 years. They deserve a medal for persistence. We need to do better than that. We need to get this thing over in a maximum. Importantly, got to be fun. The kids have to enjoy it. If it's hard work and difficult, they're going to jack up. They're going to get upset with you. You're going to get upset with them. It's just going to be a mess. So it's got to be fun. And vision therapy is like any other therapy. A little every day is far more powerful than an hour or 2 a week. And you need to see it through. It's no good starting these things with a big flurry and then giving up. I have some parents who say, hey, can I do 2 hours a night? The answer is no. You need to do a little bit every night and get in the routine of doing that. And again, not all therapies are the same. You've got to find the one that works for you. Training visual skills is super powerful. Now, there are many therapies. There's speech therapy, occupational therapy, all different sorts of therapy. I found out the other day there's equine therapy. Horses helping people relate to, all of these therapies are great. But I'm telling you now, training is the job with dyslexia and learning problems. If you train the core visual skills, you literally, and this is absolutely true, you literally cannot fail to see improvement in your child, either a lot or a little, because you're training what we all use when we read and when we learn. I've done this particular program that I've got with dyslexics, Asperger's, ADHD, autism, kids, adult illiterates, and even we trialed these techniques and developed our special program. I looked for live subjects. That sounds terrible, doesn't it? But I did. I wanted kids that were actually I could experiment on and refine these things on. And I looked for live subjects. And we found them in a school in Malaysia, very closely associated with that deals with refugees. So these are bright kids who might be 9 or 10 years old, never sat at a desk, never held a pencil. And so they sit them at a desk and say, start learning. And they go, nope, nothing there. They don't know where to start. They can't get their head around it. They don't know where to go. So I'm looking for bright kids who never had the chance to learn and were stalled on the starting blocks. And our therapies were instrumental in getting them to start to learn. My vision therapy works on this principle. Give your child a fish and you feed them for a day. Teach them to fish and you feed them for a lifetime. What is that proverb saying? Give a child the skills they need to learn and they will learn. And that's what good vision therapy program actually does. It gives you the skills that you need to learn. Here's some more testimonies from some of my patients. These are local people who've had really good results with their kids from struggling with his reading, more interested and more capability. Look at this one. Tina's little boy went up 12 reading levels in 6 weeks. This is incredibly powerful. So let's recap on how you can conquer visual dyslexia and learning problems. Let me show you how. Number 1, get a professional eye test. Number 2, do some home skills vision test and check the symptoms yourself. Number 3, please do something positive and proactive about it. And here's what I believe is the best thing that you can do for your child and their future learning. I've written this special program called Learning at Light Speed. It's a home vision therapy program. It's an exclusive program which trains the actual visual skills your child needs to learn. It works through a developmental progression, starting with the very basic skills. We take kids right back to prep and the skills that they use in prep, and it progresses right through to advanced skills. So we start basic and we build on that foundation so that there is no stone left unturned. Every I is dotted, every T is crossed as far as their visual skills are concerned. Here's a cool thing. It involves games and therapies which are fun, highly targeted, and take only 20 minutes a day, school days only. So we're not talking about something that is going to completely destroy your life to do. It's something you can integrate into your normal life. And it can catch a child up. And in many cases, now please take note of this, in many cases, and I've seen this again and again, give them an unfair advantage over their peers. I use the same vision therapy program regardless of the age of the child, even with adults. Now, here's the thing. For a child who's in grade 1 or 2, they will start into the therapy program and they'll catch up fairly quickly. But if you keep them going, they will start to learn skills that most kids don't get until they're in grade 4 or 5. Do you think that gives them an unfair advantage against their peers? Do you think that means they can do things more effectively and get better results? It absolutely does. Also, this has been designed by a passionate professional, that is me, who has experienced the anguish you are feeling right now. And, by the time I developed properly, my daughter was actually through school, and we've done a lot of stuff with her, and she's gone fantastic. I have to admit, she's just been amazing. But listen, I've experienced what you've experienced, and I designed this to help minimize the pain and maximize the potential of your children. It's been designed to target the visual skills your child needs to succeed, not just my optometry measurements. When I go to conferences, everybody sits around talking about all these measurements that have changed. As a parent, you would say, I don't care. I want to see my child's life change, not your measurements. So that's what I've targeted. Also, it's been designed with simplicity and fun in mind, because that's how you get kids to do these activities. And above all, it works. We have proven results, guaranteed. You will definitely see improvement in your child. You literally can't miss. If you do the work, you literally cannot miss. So here's the type of things you'll get in Learning at Lightspeed Vision Therapy Program. 1, very clear instructions. We lay out clearly what each exercise is trying to achieve and exactly how you do the exercise or game, and I'll show you this in a moment. All the charts and handouts, everything you need are supplied, so you can run off copies as you need them. record sheets so you can plot out your child's progress with each activity, email support. Many parents just email me and say, oh, we're going fine, or I had a little bit of trouble with this, and as soon as I can, I email them back. And so there's lots of support there. Here's a few examples of the activities that you'll be doing. This is a cool one called Capture the Mosquitoes. It's an eye movement and hand-eye exercise where the kids have got to circle each mosquito 3 times. Then they have to do it in numbered order. It's a lot more demanding than you think. And of course, we give you the sheets for that. Here's how a typical exercise is laid out, with a heading, the purpose, what you will need, and the charts that are provided, and then the method, 1, 2, 3, 4, 5, 6, 7 method, and then variations you can try on that as well. Here's what a chart looks like. This is one of the charts that we use. It's actually better than this. This is sort of a reproduction of it. Here's another one, visual memory activities. It's the objective, what we're setting out to try and do. The activities, activities A, that's the tray of household items, and then B, toothpick patterns. And we give you lots of ideas. So we're using stuff around the house, but we're using them effectively. So if you are struggling right now with a child who has dyslexia, learning difficulties, Asperger's, ADHD, or is just plain underperforming, and you know they can do better, then this could be the best news you have ever heard. And hopefully this webinar has been helpful. You've learned a lot, and hopefully some things are ringing true for you. But if you get to the end of this webinar and have not committed to anything, you can rest assured that you have a 100% chance of changing what? Absolutely zero for your child. If you've never done therapy before, you might be a little overwhelmed and saying, oh, I don't know if I can do all this. Listen, we are here with you every step of the way. It's simple, it's easy to follow games your child will love to do, and we target all the important areas you need to develop, or your child needs to develop, in order to learn effectively. So these are the areas I'm going to outline excuse me, briefly, the areas that Learning at Lightspeed targets, the visual skills Learning at Lightspeed targets. Just to let you know, there are 7 key visual skills for your child to learn effectively. Number 1 is focusing. If we help focusing, we will increase concentration for reading. We will help them copying from the board, the change of focus from distance to near and back again. It relieves tired, sore eyes and headaches. It improves comprehension and retention. The second one we're going to, second key area we look at is eye teaming. Eye teaming and you will increase concentration, improve reading flow and reading speed. You will deepen. Here's the third area, eye movements. If you help these, you will help improved reading flow. You will decrease misreads or skipping of lines. You will help children copy from the board, because when they change from distance to near, they'll be able to find their place effectively. You will also help them improve in ball sports, especially things like tennis, cricket, baseball, and even soccer. Here's the fourth area, visualization. This is key in learning and spelling. So we can use this tool to improve spelling, and I mean dramatically improve spelling. I had a little girl who was in grade 3, beautiful little girl, lovely girl, could not remember any spelling words hardly at all. She remembered 4 or 5 words in an entire month. When we went through the vision therapy, gave her this skill of visualization, in her first month after that, she learned 155 words. So from 5 words to 155 words. Greater creativity. We use visualization when we are creative. Here's the fifth area, laterality. This is involved in those pesky reversals of numbers or letters. So if your child's writing things backwards, this is the module that will work for you. Hand-eye coordination is involved in things like writing and also ball sports, especially catching and batting. And we can improve all of those if we train hand-eye coordination. And then in number 7, we've got other perceptual areas like coding, sequencing, and a whole bunch of things that are key to learning. So if we treated each area separately, I would normally charge $297 per module. So if you add it all up for focus, eye teaming, eye movements, visualization, laterality, hand-eye coordination, perception of training each of those areas, if we charge you $297 a module, would be $2,079. But that's not all. Of course, we're going to have full support. So you get simple instructions, you'll get video demonstrations, you'll get email support, charts provided, record sheets, everything you need to transform your home into a vision therapy center with you as the trained vision therapist. That is valued at $500. We're including that. The full value of what you will get in Learning at Lightspeed is going to be $2,579 worth of value. But before I reveal to you a special price, because of course you won't pay that. That's what it's worth. I'm not going to ask you for that. Let me add 4 incredible bonus parenting books that can have a huge impact on your life, your family, and your children. You know, your parents care about kids. I want to offer you some great books I've sourced on parenting, which can work fabulous and can really make, really add something to your families. Let's have a look at these. These are free bonuses. Number 1, the involvement in parents become actively involved in their children's schooling. It can help your kids make the right decision when it comes to schooling, and it's valued at $27, yours free if you join Learning at Lightspeed now. Number 2, this is a great book, 75 Q&As about how to raise great kids, including the following questions. How should I deal with my child being a bully or being bullied? But, if your child is the bully, how do you deal with it? What should I do to stop my child's lying? How do I know when it's okay to leave my child alone? How can I help my child make new friends? How can I help my child develop? How should I deal with a picky eater, young child about money? What should I do to encourage my child to read it at $40? 3. Learning answers to things like how to define success, the power of role models, teaching social skills, how to handle money properly. Some of us parents might need to do that. Plus, there's many more answers. It's valued at $37, yours if you join Learning at Lightspeed. Another one, the Smart Parenting Program. It's access, email access. Total value is $2,000. But I tell you, or ask you the question rather, kiss another one. How much? Bit of region therapy on the internet and so on costs around $139 a session, and most optometrists recommend twice weekly sessions for at least 8 weeks, with often a second block a month or 2 later. So you add $2,224 plus from the schools, snacks along the way, maybe a trip to McDonald's for 16 times. Time dollars fuel and that's another. You have to do 2 blocks. It's $5,708 is incredible. Or you don't want to take your child twice a week to the therapy rooms. That is if you can even find one in your area or your city. And most of these therapies, remember, are designed mainly to change the optometry measurements. They work focus on eye coordination primarily, which is not but it really needs to improve performance, and oftentimes it doesn't. Now, that's a lot of money for something that doesn't necessarily see your child learn better. So let me explain this again. My therapies and exercise change focus and eye coordination measurements in my office, but an observable improvement in your child's learning and reading. But what about other doctors, professionals? Overcome dyslexia? Well, you probably really area. Counterclaims dyslexia is a huge area. How much do they cost? I would tell you to beware of any miracle cures because they simply don't exist. I'm sorry. Mine is not a miracle cure. Nobody else's is either. Magic colored glasses, which incidentally, last time I priced them, were well over $1,000 for the testing and the glasses, and that's just the initial. So magic drugs, magic eye movement or body movements, hypnosis, etc., they may be beneficial in some cases, but I'm telling you, they are not miracle cures. Beware, beware. You could also, let's look at some of the other possibilities out there. You could also have your child assessed by a pediatrician who's likely to recommend medicating your child to help them to learn with drugs like Ritalin or dexamphetamine. Cost of consultations and medications are usually over $1,000 a year. Cost to your child in side effects could be anything from aggression, depression, suicidal tendencies, could be sort of just anger. Oh, look, I can't even list the side effects. There's thousands of them. Or you can have your child assessed by a clinical psychologist, identify the areas where your child is behind age norms and their IQ, and they may offer a few suggestions as to how you can help them, but no actual program is there. So they might say, I'll get them to sit closer to the front and don't give them any more than one instruction at once. That will cost you $550. You get a nice report, but you don't get something ongoing to do with them. Or you can hire a tutor who can only do what you or a teacher can do with a bit more pizzazz, skill and effort, and they're one-on-one. But they're still fighting exactly what you are, and your teacher is the lack of visual skills. That will cost you, in my area at least, $90 a week, which is $4,680 a year, and they battle the same things you do. You're sort of reinventing the wheel here. You still haven't solved the problem of the lack of visual skills in your child. So the fact is, there is no comparison. Doing something is always better than doing nothing. So vision therapy is not a magic quick fix. It takes time, it takes effort, but there is nothing else that can train the actual skills that your child needs. Now remember, I promise you that you won't pay anything like the other guys have for all of their ideas, and you certainly won't pay $2,727 today. Today I have a very special offer for you, just for you, because I know what it's like to have a child with a learning disability. We struggled for years. Because I'm passionate about seeing kids succeed at school. It's one of the real joys of my life, because I understand your frustration as a parent, and I want to help you. Because I know that most of you want to do something, anything you can, to help your child and save them from a miserable academic future. So, $2,727 value, you will not pay that today. Today, it's going to be $127 a month. And that is a pretty good deal for all of that value. It's a huge value, but let's make it really cool, and let me give you some extra special mega bonuses. You're going to love these. These are valued at $168. Bonus 5, teaching good decision making. What we do in this one is teach your child decision making, helping your child to make the right decision every time. Big and difficult tasks suddenly become easier. Special techniques and psychology tools to achieve fast results. I've actually read it. It's good. Valued at $37, yours free today. Number 6, Asperger's answers revealed. If you have a Asperger's child or a suspected Asperger's child, you're going to love this. Learn the secrets of how to understand your child and how you can bring the best out of them academically and in life. It's valued at $47. Yours free. This is one we should all look at, folks. The child diet dilemma. Ouch. Did I say take them to McDonald's before? I think I did. Anyway, learn how to prevent childhood obesity with powerful tools and strategies that can help you with your child's diet issues, valued at $37, yours free. And also, if you're a single parent, this is a special one for you. It's a great book full of advice, insight, and tips for those who are parenting alone, including how to deal with your ex and how to help your children adjust to the separated situation. It's valued at $47, yours free. So here's what we get, what you get. 7 therapy modules, full support and email access. Plus, you also get all of those 8 incredible bonuses, total value $2,875. And remember that for 8 weeks of in-office vision therapy, it was $2,704. But this therapy is the same price for 36 weeks. Now, that's actually 4.5 times better value for the same cost. Of course, you're not even going to pay that. You only have to pay $127 a month, and you get these 8 incredible bonuses straight away. So, let me remind you as I wrap it up once again that doing something is better than doing nothing. That if you give your child a fish, you feed them for a day, but if you teach them to fish, you feed them for a lifetime. So please, 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 give your child the skills they need to succeed in learning for a lifetime. It's only $127 a month to change your child's life forever and conquer dyslexia and learning disabilities and give your child the chance they have to become everything they could possibly be in learning and in life. Click the button below and let's get started. It'll take you through to a page where you can have another reminder of what it is, but click on it. It's a simple PayPal thing and you can start immediately. You can start tonight or tomorrow night in your own home, being your own vision therapist, and start changing your child's life forever. That's it from me. My name's Darren Brown. Thank you for listening to our Learning at Lightspeed presentation. And if you have any questions, please email me. I know this is going to work. It's worked for hundreds of my patients. It's going to work for thousands of kids around the world. It's not a quick fix, but it will help your child. That's my guarantee. We'll catch you next time. Bye-bye.